As part of your journey, you may need to see a hematologist, a doctor who specializes in bleeding disorders. Here is a glimpse into what to expect at a hematology visit and how you can prepare.
Hi Connie, I'm Dr. Kafouir. It's great to meet you. What brings you to our clinic today? How can I help?
Hello, Dr. Kafir. I was referred to you by my gynecologist. I've been experiencing some symptoms and she ruled out other issues. So she thinks I may have a bleeding disorder.
Okay. Well, I'd be glad to talk about these issues with you. Can you walk me through your symptoms and the history of these symptoms with as much detail as you can recall?
I've noticed that my periods tend to last at least 10 days or more. I've had a very heavy flow every cycle. It disrupts my daily routine. My mother says we're just a family of heavy bleeders,
Okay.
but I don't think this is normal. Since I was little, I'd had frequent nosebleeds that last at least 30 minutes. And I have to pack my nose full of tissue and gauze.
Well, I'm sorry to hear that you've been dealing with this. When did you first start having these symptoms?
I've noticed the heavy bleeding since I first got my period at 11 years old. I charted my blood loss during my last few periods and brought them with me. It's the validated menstrual chart from Better You Know, and my scores indicate that I have heavy bleeding. I have also tried to put all my symptoms and history in the Better You Know healthcare diary. Lastly, I took the Better You Know free validated risk assessment tool on their website, and it shows I'm at risk for possibly having a bleeding disorder.
Doctors may not always understand what you mean when you say, I bleed a lot during my period. We're clinicians, we like numbers and data, so we recommend that you bring tools and resources to help us better understand your specific experience. This menstrual chart that Connie has been using for the past few months and has brought in for me to review is incredibly helpful. It tells me how much she's been bleeding and for how long, which helps me help her. Well, thank you for bringing this tool to my attention and sharing your results with me. I'm glad you've been keeping track of your signs and symptoms. This really makes my job a lot easier. Now, just so I can better understand your situation, I just have a few more questions to ask. Do you have a family history of bleeding disorders?
I don't know of anyone in my family who has a history of bleeding disorders, but I don't think anyone's ever been tested.
Okay, well then let's change that. Let's get you tested. The next step is to get some blood work. There are a number of diagnostic laboratory tests that will help determine if you have a bleeding disorder. Now, none of these individual tests will give you a definitive diagnosis of a bleeding disorder, but when I take all of these test results together, I will be able to make that conclusion. Well, I think you have symptoms of a bleeding disorder and we should run some tests. I'll check some blood cell counts and clotting factor levels. You know, the most common bleeding disorder in women is actually von Willebrand disease, but women can also have hemophilia, platelet disorders, rare clotting factor deficiencies, and others. Now, if you do have a bleeding disorder, it may take some time for us to arrive at a conclusive diagnosis with the exact type of bleeding disorder, but I'm glad you're taking the steps to better understand your health. Do you have any other questions for me?
Last question. If the results show I do have a bleeding disorder, what happens next?
If you have a bleeding disorder, I can assure you that there is effective treatment to manage and prevent your symptoms so you can live your best life. And we can put you in touch with local and national community-based organizations of empowered women, young girls, and people with the potential to menstruate all across the country who have been able to connect and find that sense of community amongst each other through their bleeding disorder. And your entire team of doctors will work as a cohesive team to give you the best care possible, myself included. If you don't have a bleeding disorder, then we'll discuss the next steps for who to see to help determine why you're having these symptoms.
That makes me feel much more hopeful about this journey ahead of me. I think if I truly have a bleeding disorder, my mom and my sister probably need to get tested themselves. But overall, I'm feeling optimistic and like I'm finally back in control of my own health. Thank you
Good.
for all of your help.
Thank you.